Plantar fasciitis is a common diagnosis. Chronic heel pain, even acute heel pain, is a common presentation for patients to a foot and ankle surgeon. Plantar fasciitis, by definition, is inflammation of the ligament on the plantar aspect of the foot. Typically, the patient will have post-static dyskinesia, which is essentially pain upon arising from bed or pain upon arising from a seated position. Typically, the pain is in the central plantar aspect of the heel, or maybe a little bit to the medial or the inside of the heel. This can be quite significant pain, with most patients reporting this as a burning or stabbing type pain. Typically, we will obtain an x-ray. Typically, what we're looking for with an x-ray is evidence of a stress fracture, bone mass, or some other cause for heel pain. However, the most significant diagnosis as it relates to heel pain is plantar fasciitis. Roughly 3 million patients in the United States are diagnosed with plantar fasciitis every year. Some of them have recurrence. This can be a long-term difficult problem to manage, but typically we see that plantar fasciitis is responsive to conservative therapy. Typically, treatment will include an anti-inflammatory medication, stretching exercises, icing, avoiding barefoot activities or ill-fitting non-supportive shoes. A good over-the-counter insert is often a recommendation. Oftentimes, physical therapy with ultrasound and iontophoresis will be required. When that does not work, we often consider more aggressive treatments such as corticosteroid injection, night splints, occasionally immobilization with a fracture boot or even cast immobilization. Some more advanced treatments include platelet-rich plasma injections and ultimately surgical intervention with a plantar fasciotomy. Most patients respond to conservative treatment for plantar fasciitis within 2 to 3 months. Conservative, consistent treatment for plantar fasciitis, which is not fruitful, longer than 6 months, typically requires more aggressive treatment and may in fact require surgical intervention.